Yes, so welcome to the second episode. We want to introduce head CT scans, and then, if possible, if time would allow us, we want to just mention some pathologies. Okay. So, can you picture that this picture you are seeing? Okay. It's actually a cross section of your head. Can you see that? Ola. Can you see that? If this is your brain, this is a cross section looking like this. Okay. Are you good?
Yes.
Good. So let's identify some structures before we go to the head CT scan. Okay. So we are going to identify the skull. Okay. Remember? Okay. I can't say remember. It's the favorite guys have taught them anatomy. No, but I think the June guys, when I was teaching neonatal jaundice, I spoke about the scalp, isn't it? Do you remember?
Yes,
Doc.
So we are going to begin with the skin and then the scalp together. So I'm going to trace it here. So as you can see, this is the scalp. So every human being's head begins with what? The skin. So this is where the hair comes from. The Brazilian hair you've been braiding, like Linda's hair. So this is the skin. This hair. Then it goes back like that. That's the skin. Then from the skin, you realize that you come to the bone, although there's a muscle here, but I want to highlight something. The bone is what I'm interested in, okay? Because that is what will show on the head CT scan that you see it feely. Please, Abna, can you go mute on this for me? Is Abna here?
Yes, please.
Okay.
Okay, Doc.
Please, the others, what structure or what substance is found in bone? Can you answer me, please? What structure or what substance is found in bone? Class prefect of the June class. Nah?
Yes, Doc.
Yes. What structure is found in bone?
Structure. Doc, is it? Sorry.
Sorry, is it?
Sorry.
Is it Twaso? Uh-huh.
Doc, no idea.
What did you want to ask me? Say that answer. If it's wrong, I'll call you Abelekuto.
Doc, I wanted to say the bone marrow.
The bone marrow. Okay, so what I wanted to hear was what? The bone matrix, okay?
Yes.
And then what mineral is in the matrix?
Calcium.
Calcium. So the mineralized bone matrix, isn't it? Anale, do you agree?
Yes, I do.
The bone matrix, which has been mineralized, contains calcium phosphate. And there is a reason why I'm telling you this. Okay, so please take note of that. So you see that after the bone, you have what structure is this? That blue structure around the head. What is that? Around the brain, sorry. After the bone, there is a blue structure. What is that?
Meninges.
The meninges, okay. The meninges. Then after the meninges, you have the brain, isn't it? You see that the brain, when you look at the cross section, it has been demarcated into what color is this? I'm good at colors, but this one there, I'm not sure I know the color. What is the name of this color? Amali, what is the name of the color? I mean, you guys in colors.
I'm not sure, but I don't know. Pinkish, reddish.
What are pink? The ingo beside. How long?
Yes, dog.
Yes. What color is this?
Look, I have no idea. Maybe
Okay,
a
so
lighter
the
shade.
yemfa analogy. So they are also pinkish. I do any pink, man. Kind of reddish brown or something. Okay, good. So do you see that even in the brain there is a demarcation? So this is actually the cerebral cortex, isn't it? Are you following me? Then this actually the white matter. The white matter, okay? The white area is the white matter. Are you getting me? Okay,
Yes,
let me put it this way. You know that neurons, okay? No, you can talk. You know that neurons, this is an example of a neuron. The brain and the spinal cord, the basic functional unit of the nervous system is the neuron. True or false? True or false?
True.
So, if you remember, this is the cell body. You remember? Cell body. Have to use another color too. Like this. So remember, this is the cell body. And this was the axon. You remember, right? And then remember that around the axons, structures are this. Now, what structures are these? Now, okay, let's try Equia. What structures have I drawn around the axons? Thomas, what structures have I drawn around the axons?
Something sheet or something.
Hey, who?
Myelin
Something. Myelin sheet, and so you needed the morale from all the. Okay, no, this is abnormal. Myelin sheet. Do you remember? Class, do you remember? Good. So the myelin sheet contains fat, isn't it? Isn't it? It contains white fat, okay? So when you check, this is the cortex, and the cortex is actually what? Made up of the cell bodies, the gray matter. Do you see that? Then the axons. So if I'm to draw, you see that the cell body is here, then the axon comes out. Cell body here, axon comes out. Cell body here, axons come out. So the brownish ones contain the cell bodies. Do you see that?
Yes, sir. Yes, sir.
Then the axons come out. So my point is that this part is actually the gray matter. The gray matter. And it is the cerebral cortex. The gray matter. So we have the gray matter and then the white matter, okay? So the point I want to make here, this is very important, so that when we get to the CT scan, you understand where I'm coming from. So the gray matter and the white matter. The white matter I'm saying that contains myelin sheath, isn't it? And myelin sheath is actually what? Filled with a lot of what? Fat. Do you understand? Do you?
Yes, sir.
Okay. Then what structure have I outlined?
Ventricle. The
All of you agree that's a ventricle, right?
Yes, though.
So the
Ventricle.
lateral ventricles. What's the third ventricle? Vefa. Bomode. So also when you see SF analysis video, no. Tell me send it. Ma bomode na share why. Na no so me can one sem. Why?
Yes, though.
Now be who work. The two lateral ventricles. Okay, the two lateral ventricles. Are we good? So now we have an idea. This hole here, okay, is actually the frontal air sinus. Okay, the frontal air sinus. So it depends on the level at which the brain was sectioned. You have different levels. Okay, let me show you, for example, another picture. Can you see this? Can you see? So you see that here the diagram has been labeled for you. Can you see that? So let's do some orientation. You can see that this is the scalp, okay? This is actually the scalp. And you can see that this is the scalp, which is made up of what? A mineralized bone matrix, okay? That's the scalp. And this is actually the meninges. How many meninges do we have? Ikuya?
3.
3. Why are they? Then, as I said, this is the what? The gray matter, made up of what? The cell bodies of neurons. Gray matter. Gray matter. And now, white near then. White matter. But I said white matter. Or no, to do on or the myelin sheet. Hey, I've forgotten. Hey, this Anale, you don't understand she. Anale, or she's gone out to buy something. She can't hear her name. Good. So, as you can see, this is the ventricle. Okay, so the space there, ventricle. Do you see that? Are you ready to zoom? Are you ready?
Yes.
Good. Now watch here. If you watch here, look at this is the level of. Can you see that? Look at what this place. So I'm going to show you something. Do you see this? Look at the structures that are around the ventricle. The periventricular structures. Let me mention them. The periventricular structures. Can you see that? So the structures around the ventricles. Can you see?
Yes, clotted.
Okay. So I want you to take note that this is what I want you to take note of. Look at this thing, okay? I just want you to take note of this region and then this region, okay? I want you to note that this part is actually the basal ganglia. The caudate nucleus is part of the basal ganglia, okay? So the structures around the ventricles, the top part, okay? The top part is the basal ganglia. I just want you to keep that principle. The down part, okay, is the thalamus. Nasuma,
Yes, though.
you're my baby girl for the night, so that's why I'm worrying you.
Yes,
Which part of the brain gives rise to the thalamus and then the caudate nucleus? Or maybe, let me say, some parts of the basal ganglia. Embryologically, which part of the brain?
No, for the two are from the prosencephalon.
The thalamus, are you sure? The thalamus.
From the diencephalon.
Thank you. That's what I want to hear. Thank you. Good. And so you would agree with me that This is what? The anterior. This is the anterior side of the skull, and this is the posterior side, isn't it? Are we good?
Yes, sir.
Good. Now let's go and see the CT scan. Now you've seen the anatomy. We are a bit conversant, not so conversant, but a bit conversant, and we thank God for that. Now look at the anatomy. Ta-da! Can you see? Can you see what's going on here?
Yes, doc.
So you can really picture, like you can really imagine what is happening around here. For example, what structure is this? For example, what structure is this? You can tell me. Ekia, what structure is this?
The skull.
The skull. Thank you very much. The skull. Now, I made a statement on the anatomy model. Why do you think the skull is white? Why is the skull white on the CT scan? Anybody? Because of the calcium. Do you understand, everybody?
Yes, doc.
Because
Yes.
the matrix in the bone has been what? Mineralized by the calcium. And the calcium, that is why the skull is white. You see the x-rays to the bones are white, right? On x-rays. And that will be because of what? Calcium in bones. Do you get it?
Yes, doc.
Thank you. Now let's go ahead. I want you to take a close, okay, at the periphery. Look at this. I'll take it off again, but look at it, okay? Look at the periphery. Then look at the center. What can you tell me about them? Do you see that the periphery, there is a whitish line like that? Can you see that?
Yes, doc.
You can all see that, right? Look at this place too. Whitish line that goes like this. But when they come to the center, it is dark. Can you see that? Who can
Yes,
tell me
doc.
the reason why?
Yes, so.
Who can tell me why this place is darker and then the rim is whiter? Who can tell me why? It is because I said the cell bodies are here, isn't it? You do remember that reddish brown debate I was having with Anali?
Yes, doc.
And this is what? The white matter. We said that the white matter actually is what? Surrounded by what? Myelin sheath. And myelin sheath is contained, is contained by fats. And you know fats, you know how they behave. They are dark or they are blacker. Do you get it?
Yes, doc.
That is why this place, all the dark areas are what? White matter. Are you following?
Yes, doc.
Thank you. What structure have I outlined?
Lateral ventricles.
The lateral ventricles. Excellent. This one is the fourth ventricle. I don't need you to know that. Okay. I just want you to know. And then why is the lateral ventricle dark? Which substance is found in the lateral ventricle? Which substance is found in the ventricles? Yes. It's a CSF, isn't it? CSF, isn't it? How long?
Yes, doc.
Are you following?
Yes, doc.
You are sad that you missed the ABG class.
Oh, doc, I was in the hospital, so
Because I'm not feeling your vibe, crap. Anyways, then look at this structure. What is this structure? What is the structure I outlined? This one.
Corpus callosum.
The corpus callosum, isn't it? Or the George Washington's Bridge. You are following. Okay, very good. Very good. Do you see what is going on here? See that everything now is making sense. Now, look at this. Look at the periventricular structures. What structure do you think is here?
The basal ganglia.
You will not be wrong to say basal ganglia. So if you see that the radiologist will see something here, and then he will say it is a basal ganglia hemorrhage or infarct. Do you see that?
Yes, sir.
Basal ganglia. And we say that this region is likely to be the thalamus. Okay, very good. Do we now get it?
Yes, sir.
Yes, sir.
Thank you.
Yes, sir.
Now, how are lesions? Let me stop sharing this and then go. What terms are used to describe lesions on the CT scan? What terms are used to describe lesions on the CT scan? Have you gotten the question?
Yes, sir.
Okay, so note it, and let's come back to this. So if you are a lesion, okay, which is whiter than the brain, do you see the brain substance? Do you see how the density is like? Can you see? Or how the whiteness is like? If you are a lesion that is whiter than the brain, just like the bone, do you see that the bone is also whiter than the brain? Right? You are describe it in density. Let me actually make this generalized, okay? But the point still remains that if you are whiter than the brain, we say you are hyperdense when you are using the CT scan. When you are describing CT scans, you say any lesion that is whiter than the brain, okay, is hyperdense. Do you get it? So for example, if I meet a lesion here, what will I say? Let's say I meet a lesion here. I would say, oh, I saw a hyperdense lesion in the left basal ganglia. Can you imagine that? Can you understand that?
Yes,
And then if you are a structure which has which is blacker than, or which is less white than the brain, you are said to be what? Hypodense. Okay, hypodense. So for example, the CSF is what? Hypodense, isn't it? Because it is blacker. Do you see that? So the lateral ventricles, what we used to know is that what? It is what? Hypodense. Are you following?
Yes, doc.
Thank you. Now,
Yes, sir.
now for most students, the bone of contention, you know that this is one cerebral hemisphere, okay? This is one cerebral hemisphere, and this another one. Do you see that?
Yes, doc.
Yes,
So
sir.
for most students, when they go to exam and then they see a lesion here, they are wondering, hey, is it on the right or is it on the left? Is it on the right or is it on the left? I don't want to bore you. All I'll tell you is that whenever you get a CT scan, picture the chest X-ray. Do you see that the chest X-ray, the apex is always on the left, isn't it? Do you see that? Hello?
Yes.
Hey, silent majority.
Yes, sir.
If you don't answer and then I go on and you ask me to come back, I won't come back.
Yes, doc.
Yo. So you see that the left side of the chest is here. So always assume that you are looking at the chest X-ray. So this is also your left. So assume that the part is here. Okay. When you do that, you'll never forget. Is that okay? Okay. So when you see a lesion here, you say it is a lesion in the what? In the right cerebral hemisphere. When you see a lesion here, you say it's a lesion in the what? In the what? In the left cerebral hemisphere. Are we good?
Yes, doc.
Thank you.
Yes, sir.
Thank you. You are done with the CT scan. Now, let's go and get the principles and then start talking about pathologies. Okay? Good. Now, listen. like I was saying, when you are interpreting, when you are describing radiological investigations, you use some terms to describe them, whether they are hypo, iso, or something. I forgot. If you are a lesion and then you have the same density like the brain, you are described as isodense. Okay.
Yes,
So
sir.
hyperdense, isodense, hypodense. Now, apart from the CT scan, can you mention other radiological investigations? Let's see the terms used to describe them. We are saying if you are too white, if you are black, so you are going to use black and white, okay? So can you mention some radiological investigations as well, apart from CT scan? What else? Radiographs, isn't it? X-rays, right?
Yes,
Radiographs. What else? What else do you know?
MRI.
MRI. What else?
Yes.
What else?
Mhm.
Ultrasound scan, right? Now, we've already established that if you are too white, you are described on a CT scan, the term you use is what? Hyperdense. Don't find me seriously. Now, a bit radiology session, specials. Hyperdense. So in the CT scan, we say hyperdense. What term, Abna, can you go mute for me? What term do we use when we see a very white structure on X-ray? Who can guess? Akosia, can you guess? Akos, can you guess?
No, though.
Anali?
Radio opaque.
Thank you. Radio opaque. So you say, I see a radio opaque. Radio opacification. Hey, what am I writing? Okay. Radio opaque. If it is the MRI, what term do we use? Anali, I'm coming back to you.
I'm not sure.
You're not sure. You're about to guess. I won't call you Abilikutu. This one.
I was going to guess hyperdense again, but
hyperdense, but hyperdense now. Okay.
Yeah.
Maulom.
Yes, Doc.
Yes.
I'm not sure about the MRI.
Yeah. So what are you not sure of? What do you want to say?
I was thinking
Mhm.
thing that it will be hyperdense, but since you told
Hyperdense.
that,
Okay. Rachel.
Doc, hyperdense.
Hyperdense. Okay, Abna.
Hyper intensity.
The term used is hyper intense. So when you are describing MRIs, if it is too white for you, it's hyper intense. If it is a CT scan, it's hyper dense. If it's a radiology, it's what? It's called radiography, whether abdominal radiograph, chest radiograph, bone radiographs, radio opaque. How about the ultrasound scan? Anali, do you have any idea? What term is used?
I'm not too sure. I feel like I know, but I don't remember.
Okay, let's see. Ekia, do you have any idea?
Doc echoic.
Oh, what can you say? But hyper echoic, And I won't know. So the ultrasound uses echo, so hyper echoic. Okay, so if you're able to reflect a lot, hyper echoic. Okay. How about if it is slow? I mean, it is not so white. What do you say on the CT scan? You say what? Hypodense, isn't it?
Yes, sir.
I beg you, don't say something funny for the radiograph.
Mhm.
What should you say? What should you say? Radiolucent. I'm very glad you didn't say hypopic. Radiolucent. How about the MRI? What do you say? Hypo-intense, isn't it? And the ultrasound, you say hypo-echoic or anechoic, okay? Hypo-echoic or anechoic. So you can have isodense, iso-intense, isoechoic, but there is no term to describe that for the radiograph. Please, have you gotten the principles?
Yes, sir.
Very good. So now let's begin with bleeding into the brain, okay? So we are going to begin with hemorrhagic strokes, right? Hemorrhagic strokes. So let's look for pictures of hemorrhagic strokes. So hemorrhagic strokes. When you go to the MAND or the picture station, what would they show to you? Or when you see a patient with hemorrhagic stroke, how would you be able to tell? Let's look for that. Okay, so I have a picture. Thankfully, I have a picture. I have one picture. Good. Yes. Oh, so. Let me see. Hey, I know how to do it. Can you see?
Yes.
Yes.
Sir.
Can you see what is going on here?
Yes, sir.
You see this. Why is first of all, how would you describe this? Yes. No. I think I've made a mistake. Before I start showing you the radiographs, I have to tell you that CT scans, you can do one with contrast, okay? That's one thing I have to tell you before I start my teaching. So we have two types of CT scans, or we have two types of investigations, okay? We have two types of radiological investigations. Okay, radiological investigation. For some investigations, you have to give the patient a contrast medium because you want to see something, okay? So for those investigations, you say, for example, I'm dealing with CT scans. So you say what? A contrast-enhanced CT scan. Is that okay? A contrast-enhanced, maybe the lesion you are looking for in the brain. If you don't add contrast, you will not see it. So you do a contrast-enhanced CT scan. Then we have, the opposite is what? A non-contrast enhanced, okay? A non-contrast, that one we took it without giving a contrast. A non-contrast enhanced CT scan. Another name is what? A plain. It means that you didn't add anything. No contrast. A plain CT scan. Are you good? Are you good?
No.
Yes, sir.
Thank you. So a contrast enhanced CT scan, a non-contrast enhanced CT scan, or a plain head CT scan, okay? And then I should say that actually CT scan is what? Actually really means what? Computerized tomography. So a tomogram is what? Taking cross sections. That's a tomogram, okay?
Yes, sir.
So a computerized tomography. Are we good?
Yes, sir.
Good. So let's begin the party. So I show this again. When someone bleeds into the brain, do you think you need to give contrast? Before I continue, if you are asked, want to do a contrast investigation, what lab investigation I'm not mute for me on this one. What lab investigation should you order? Let's assume you want they tell you, say, oh, I'll do a contrast head CT scan. Then the question comes abruptly. What lab investigation should you order before you do the contrast enhanced investigation? What is the answer?
Renal function test.
Akosia, thank you. You have to do a BUE creatinine, a renal function test. Why? Akosia, why? It is because the contrast material is what? Can be what? Nephrotoxic. The contrast material you are given can be nephrotoxic.
Yes.
Aside that, it is what? Renally excreted. So if you give it and then you can't excrete it, it will rather be toxic to the body. Okay, so you have to make sure that the patient has got a normal renal function, or even if the renal function is not normal, it should not be so abnormal that it can't handle a contrast material. Do you understand?
Yes, Doc.
Queen, do you understand?
Yes, Doc.
Okay. Excellent. So now, how do you identify a contrast from a non-contrast? Do you see these spaces? Do you see this? Let me. Can you picture this? Picture these spaces. You see these spaces is dark, right? Do you see that?
Yes, Doc.
Look at this space. They are actually the spaces between the look at this. You see the spaces you saw, those dark spaces, these are they, or these are them, if that is a correct English. These are they. Do you see that? This is what I'm trying to teach you. So these dark spaces, they are just spaces between what? The gyri. Do you understand?
Yes, Doc.
Good. So let me show that again. So if I show you this, you'll see that these are the spaces, okay? You see that one here. Do you see one here? Another here. Can you picture that? Another here. So the spaces between the gyri. Look at this one. Look at this one. Look at this one. Look at this one. Do you see that?
Yes, Doc.
All the dark ones. So if you give the patient a contrast, the contrast medium will fill these spaces. So that's how to tell a contrast head CT from a plain head CT. Are you with me? Yes, I'll show you a picture soon, but I'm just telling you how it will look like. Can you see that? So all the black spaces would what? Filled with white. It means that you have what? Given a contrast medium. Let me show you a picture of that before we describe this head CT scan. So I'm going to the net. I'm going to the net to go and show you a contrast head CT scan. A contrast head CT scan. Can you see what is happening here? Can you see? You see that all the black parts have been filled with white things?
Yes, Doc.
You can see that, right? Good. Now, let me look for another one. So I think this, you see that it means that the patient has been given contrast. That is why you can't even see the dark lines. Do you bar?
Yes, Doc.
So can I trust you to be able to, let's see another contrast enhanced CT scan. So again, this is a contrast enhanced CT scan. You see that the spaces between the gyri, they have all been filled with some whitish substances. Do you see that?
Yes, Doc.
So these are all contrast enhanced CT scan. So I trust you to be able to say, when you see this, say, this is a contrast enhanced CT scan of the head. Then they are like, wow. Why do you say it is a contrast? Because you can see that the contrast material has what filled all these spaces between the gyri. Okay, so praise God, you've been able to distinguish between a plain head CT scan and a contrast head CT. So this one is a plain, of course, a plain head CT scan. So now let's try and then interpret this head CT scan. Whenever you are interpreting an investigation, you first have to what? Mention the investigation. What did I say? First rule is what? Mention the investigation you are holding. Mention the investigation you are holding. So assuming you go there and then the examiner hands you a chest X-ray, what you say is, this is a plain chest radiograph. You are given a head CT scan. You say, this is what? A plain, or instead of plain, you want to speak more English, you can say this is a non-contrast enhanced CT scan of the head. So the first thing we are going to say here when we see this is what? We'll say, this is a plain, or for people like Queen who like to speak English. Some of us, we don't want trouble, so we just go straight to the point. Plain, non-enhanced CT scan. Let's tell the body, the part of the body which has, don't just say non-contrast enhanced CT scan. And some of them will start becoming sarcastic with you of the buttocks, isn't it? They say that you look some way. So just add of the head, okay? First step, will say, this guy has seen that this is not a contrast CT scan, and he's seen that it is a CT scan of the head. Do you understand?
Yes, dog.
Good.
Yes,
Then the
dog.
next thing is what? Come to what? Can you see this lesion? You can see this big lesion. Now the next thing is what? To describe the lesion, isn't it? You have to describe, if there's a lesion, you have to describe the lesion. Do you see that? So the next thing you see here is that showing what? Yes, showing, yes. Oh, describe it. I think we've gone to the terms. Showing,
Showing a hyperdense.
Thank you. Showing a hyperdense lesion, isn't it? Where is the lesion? Is it on the left or on the right?
On the left.
Thank you. Is it in the cerebrum? Say yes.
Yes.
It's in the cerebral hemisphere. So showing a hyperdense lesion in the left cerebral hemisphere. Hey! You've been able to describe the head CT scan excellently in the left cerebral hemisphere. This is a CT scan which shows I can see some white thing here. Ono onye pe o. Tell me what you can see. I can see this white thing here. Ono onye pe. Omo de chire ona. What shall I say? Please, which structure is this? Which structure is this?
The sinus.
The frontal. Hey! Wait a minute. I'm sorry. Let me see.